Good evening. Good to have you with us in the 9 p.m. edition of the Urban Debate. Continuing with our special series, where on most Fridays at 9 p.m. we take up the issue of mental health. Tonight we do the same. In fact, today, September 10th, every year is the day that is observed as the World Suicide Prevention Day. Since we are all in the middle of a devastating pandemic, a pandemic that has affected our lives in so many ways, forever maybe altered the way we live our lives. A pandemic that has brought along so many different kinds of challenges, unprecedented situations, such different kinds of stress for people, has obviously also impacted us mentally, and which is why it is even more important. It would have been any which way, but it is even more important to have a conversation on the large number of suicides in this country and ways of preventing it. It's simply our effort of spreading about some more awareness, of having a conversation. The problem, viewers, with mental health is that most people don't want to talk about it. Most people don't feel comfortable talking about it. And when they do, and when they reach out, those around them don't understand, don't get it. It's because it's not been part of our lives. We've never been open enough. It's always been a taboo. So tonight, let's talk about the fact, and let me tell you that suicide is actually a leading cause of death worldwide. According to WHO, over 7 lakh people die by suicide every year. In a sense, if you see it in another way, one person dies by suicide every 40 seconds in this world. It's the 4th leading cause of death in the age group of 15 to 19-year-olds. You see a large number of these cases there. Often it's mental health disorders that exist already that lead to such an extreme step. Sometimes it could also be impulsive in the moment of a crisis, or a crisis that's gone on for too long. The person just doesn't want to deal with it anymore, or cannot and doesn't know what to do. But can you believe this? Every 40 seconds, someone ends their life in this world. This is the WHO data, which is why it is important to talk about it. Reports say that NGOs dealing with suicide prevention are receiving more calls in the recent times than in the pre-pandemic times. The most vulnerable people are falling under the risk category include those who have in the past attempted this, have in the past attempted to take their own life, or at least thought about it. Somebody with depression, or an alcohol problem, or even a drug problem. Those who are suffering from severe emotional distress. And when you're in a pandemic at an unprecedented time, it's possible to many that they undergo a severe emotional distress. People suffering from chronic pain or illnesses are also in the high-risk category. And of course, those who are socially isolated. But this is what I have managed to learn, basis the basic reading material which is out there, what the WHO has to say, and in my past interactions with the expert. But since I'm not an expert, we decided to call some of them here and have a conversation about it. Let's say good evening to Dr. Tara Mehta, Senior Clinical Psychologist, Coordinator for Clinical Psychology at Forest National Mental Health Program, joining me this evening. Sonal Jiani, an LGBTQIA activist, co-founder for Umang Support Group, very vocal about these challenges. Johnson Thomas, Director for ASRA, which is a 24-hour suicide prevention helpline in Mumbai. Ajay Malhotra, member for Sumetri Crisis Intervention Center. Dr. Kumkum Jagdish, mental health counselor. And Dr. Maithili Hazarika, Associate Professor of Clinical Psychology at Guwahati Medical College and Hospital. Thank you so much to all of you for joining me in this conversation. Let me actually start with Johnson Thomas. And Johnson, specifically in the last 18 months, Has there been an increase in calls, in the stress that people have, in the way that people are reaching out?
Yes, definitely. I mean, there has been a huge surge of calls regarding distress, but the distress has changed completely from the pre-pandemic times. In the pre-pandemic times, it was basically exam stress and love relationships, breakups, and those kind of issues. Whereas in the pandemic times, it's mostly about existential issues, more about money, not having enough money to survive, not having enough means to survive, not having a job, not having, and relationships breaking up because everyone's caught up within the four walls of their homes, and they're not able to de-stress themselves because everyone's there demanding attention at all 24 hours, 24/7. It's difficult especially for women. I mean, there's so much domestic abuse happening during this time. So a lot more calls are coming from these areas rather than what previously happened was where students used to call up, largely students and young adults used to call up. Now it's across the board. Everyone is calling up.
That's actually a very interesting insight that you've shared, and I wanted to talk, more about this. The change in the nature of the calls that people are getting. Ajay Malhotra, would you be able to, weigh in on this as well and share your insights if the nature of the stress that people are undergoing has also changed drastically?
I think, like my colleague have just said, Johnson has said that, of course, there is an increase in number of calls during the pandemic. The reason may have varied, okay, because we are able to add additional reason: loss of life of near and dear one, loss of jobs, and sitting inside the home throughout the day and doing nothing, doing work from home. This is all very pressurizing for the people who are going through this time of pandemic. So I think that these different reasons are accumulating for the people more and more to call us. And I think on an average, there is an increase of about 25 to 30% of calls we receive per day.
Per day, those many calls you receive, and what is it that most people are looking for? And I'm asking these questions, which may seem very obvious to you, but it's very important for our viewers to be able to also understand. And maybe a lot of them may connect if they're going through a tough time. What is it that people say when they reach out, and how is it that you are able to then help them?
Because people know that we are a suicide prevention center. The people who are going through a feeling of distress, depression, isolation, and committing suicide, they give us a call and talk to us, share their feelings at that point of time when they are thinking of ending their life. And maybe after talking to us once, twice, or a couple of times, they are able to unburden their feelings. Like we say that they are able to depressurize themselves. Maybe the people may be calling us with a different reason, with different kind of analog. But in the end of it, we know that if they are thinking of suicide, somewhere they wanted to save themselves. Somewhere they wanted to save their own life by calling a center like us. And talking to a stranger, talking to a volunteer who can understand them, who can appreciate their feelings without being judgmental or critical of what the phase they are going through. So they talk to us and unburden themselves.
Yeah, because I asked this, and like you said, often it is that if you're able to talk to somebody 2 or 3 times, listen to them, that's helpful as well. And what happens, Dr. Tara Mehta, is often when we know somebody of someone in our circles, close or distant, and they attempt suicide, the reaction is that, oh, never thought so, didn't realize the person was actually going through it. Whereas there might have been instances when that person tried to reach out and people didn't actually register it, isn't it?
That's right. I think that people often overlook the smaller symptoms, and they're not able to catch on the symptoms that begin little by little and then build up to the point where the patient just feels, the person feels that there's nothing to lose anymore by taking their life, and there's nothing to live for. And I think that it's important to create awareness about what those smaller symptoms are to look out for. Is it isolation? Is it the fact that there's a change in their appetite? Is it the fact that there's a change in their biocycle? Is it the fact that they just maybe are crying all the time. Maybe they've said that they're just unable to cope and one is not taking them seriously. So I think that there are a variety of these symptoms that one wants to look out for, so that one can provide intervention at an early stage, unless the patient decides to commit self-harm. And it is with that intention that we at Fortis have this 24-hour helpline, which is manned by a clinician 24 hours a day. Our main aim is to be able to cross into all parts of India, which is why we have clinicians who speak 16 different languages, so that we can cut across all parts and not just sort of adapt to the major cities, but also to tier 2 and tier 3 cities.
In fact, I was reading a comment and actually a concept that's also been given by somebody who is with Fortis, and Dr. Kedar Tilve actually shared the term WAIT, where W is for watch for distress signs and behavioral changes. A is for ask about any contemplation about self-harm in a gentle manner. I is to say it will pass, assure the person with proper support and help, suicidal ideation can decrease. T is talk to others, encourage the person to seek help from experts. And it's very important to highlight that, because I think most people will also struggle to figure what has to be done. So first, Dr. Kumkum, it's about watching out for the signs, knowing the signs, and then secondly, also knowing what to do in such a scenario.
What happens is, if somebody is having a suicidal ideation, they are not able to think. There are a lot of negative thoughts that are happening in their mind. So it is very important for them to call one of the helplines. So when somebody has suicidal ideation, talking to somebody is always important. It would be nice if they could talk to their family member. So when you know that you do get thoughts like this, it is always important to have a plan. And in that plan, you should have a person that you can reach out to when you're feeling low, or you're feeling a sense of helplessness, hopelessness. So somebody that you can talk to, somebody who you trust. If there is no family member, then at least have numbers that are handy, so that you can reach out to somebody and get that talk therapy session that is required. Even talking to somebody for a few seconds will help you calm those thoughts that are coming in your mind, and probably take a step back and re-look at what you're doing. So always having a plan is very important, even for the person who does get those thoughts, and also for the caretakers, or the loved ones, or the trusted ones, or a friend. Having these numbers handy is also very important.
Dr. Maitri, would you want to weigh in here as well? And then let's just talk about those who may be, having such thoughts.
Yeah, one thing is about the biological component also, because we have to take care of that. Though we know that it's not that suicide runs in families or something like that, but there are genetic loading also. We have to know about the genetic risk factors, because some genes are also implicated, and also the neurochemistry of the brain, because suicide is an emergency. So we definitely have to think about the medical side of the story, how the biological component as well as the environmental component influences a person to take a drastic step like this. So definitely, early identifiers, as everybody is saying, the risk has to be, we have to know the risk factors. So in order to know the risk factors, we are not aware of mental illness as such. In India is such a country that 83% of the people do not even have access to mental health care. The professionals are lacking. I mean to say, only 1 is to 1 lakh people. One psychiatrist is there for, not even one psychiatrist is there for 1 lakh people in India. And leave apart the clinical psychologists and the psychiatric social workers who deal as a team, because we call it a biopsychosocial problem. Because the biological factors and the psychosocial, economic factors, family factors, personality issues, substance use disorders, all these are the gamut of issues which leads a person to commit suicide. So we really have to know, all of us, this is a program, I mean to say, this is it's a plenary, and we have to maybe know about how to identify. There are certain biological, so family history. When we talk about suicide, we take the family history of a person also, considering that a person whose in his family, if there's a person who had committed suicide, then the risk factors becomes more as well. And also we have to know if person has previously attempted suicide, then the risk factor is more. And also if there are certain impulsive personality in him or a temperament which is impulsive, person cannot control his anger, so that might also lead to some kind of a drastic step. Like, we see a lot of adolescent population now, and all across the world we have seen the adolescent girls are attempting, 50% of the adolescent girls are attempting suicide. There's a WHO report. So we need to be aware of what is happening with the young population, because as we know, 16 to 29 years is high rate of suicide is there between this age group, where the pressure from the parents for education, it's a rat race. So that has to actually curtail. People have to be more cognizant of the fact that what is happening in this world is not, it have to be very, very sensitive, I mean to say. And also we have to know what are the, temperament of the children who could commit such a, who could commit suicide. So parents, there should be certain subjects in the school, maybe they should be made aware of what are the resilience factor that we can increase in us, so that we can cope with stress with some kind of mechanism which is not faulty. Because coping is one thing that we definitely have to know, and the life skills education. So there are a lot of preventive way. People say suicide is not it cannot be prevented, but actually if you can reduce the risk factors, and if you can keep the person away from stuff like weapons and pesticides and all the different mechanisms to commit suicide, I think people would be able to prevent suicide. So these are different issues. Maybe I'm adding on to what my colleagues have already said. And
No, that
yes,
was extremely insightful, since you also brought in, the family history or the genetic angle and other medical aspects of it as well. Sonal, thanks also for joining us. Often it's said that people should ensure they have a support group, have a plan in place, have a support group in place. But what happens if your support group itself isn't aware, and those group members aren't really aware of how to deal with it? That becomes another different challenge there.
Right. And I think this is a very important question, something that we were faced with during the pandemic as well. So our support group runs a helpline, but the volunteers are not really trained for suicide intervention. Unfortunately, owing to the pandemic, what happened was a lot of LGBTQI communities members faced a lot of stress, because when they went back home and being in familial spaces where you have to be in the closet about your gender and sexuality, really sort of added to the stress. It really became multifold, especially because marriage pressure was very, very high. They could not talk to their partners, although they were in anxiety. There was no relationship as such to support. In fact, it had to be hidden. Thirdly, gender dysphoria, because a lot of family members were not comfortable with a gender presentation which is different from their body. So this kind of added stress, really made it kind of difficult for communities. And the helpline number that we publicized for the pandemic, we had like almost 900 messages on the first day of publicizing it. So the problem was like quite challenging, and of course, suicidal ideation was pretty high. I think initially, what we did was sort of empathetic listening and being able to support on like verbally to the community in whatever way possible. But it was very, very clear that, we needed to also build linkages with queer affirmative counselors and offer a sliding scale. Because what is happening was that we needed counselors who themselves are aware of queer issues, so that they don't add to the, current anxiety of the person that they are sort of speaking to. And secondly, sliding scale was needed because a lot of people from trans communities or people from these communities, they had lost jobs and they could not afford counselors. So what we did eventually was actually raised funds to be building these linkages and offer free therapy, free counseling. What we tried to do was to, as much as possible, connect to already existing pool of queer affirmative counselors, but beyond that, also do support meetings and offer peer counseling, to people. It was a bit challenging, I will say, because a lot of people who needed support could not log in from their house and talk about their gender, sexuality, because, their family is around and they are worried, about being outed in that space. So, the intervention had to be like, you had to be very kind of mindful, where you kind of just allowed them to even listen into the call and allow them to just, speak on chat instead of kind of insisting on a call. But I think overall, when we look at suicide prevention, what's very important is to have that conversation openly, to ask people if they are ideating, if they are making any kind of casual, remarks around living. And other than that, I think for the queer community specifically, I would say that, the social situation also exacerbates the mental challenges. For example, there is the marriage petition, which is in the court, and the communities already don't see a future in this country, and a lot of them are not able to be with their partners. So when, the government says something like, this is a pandemic, other things are more important, it has in fact added to the anxiety of people because the social situation doesn't seem to be supportive. You can't be out to your family members. So things like that. So as a community, what we do is we offer support. We keep them, informed about what is going on in the movement, what are the government stands, keep them informed about, publicize as much as possible queer formative counselors, publicize if we are offering support for mental health. These are some of the things that we do. And at no point we claim to be somebody trained to handle suicide. We, do put them on into experts. Another major challenge being that a lot of these calls come outside of office hours. And when somebody attempts something, and which was something we were faced with a lot, it was difficult during the pandemic to sort of intervene when there were suicide notes posted on people's, social media platforms. So obviously we mobilized as a community, we worked, there was more intervention needed from the government. And I think that things like these were challenges new for us also, we are also learning.
Yes, I think that would have been one of the biggest challenges, the fact that you had to move away from what your own support and comfort, setting was, and then to be with family and friends who don't understand, and to not even be able to reach out would have been extremely difficult. And I think that's something that, Mr. Johnson, we would have seen perhaps in many other categories, especially in youngsters as well, locked up in one house with their family, unable to maybe connect with many of the family members as to who they are and what their identities are. But how do you even reach out? Because even for that, there isn't any space. You don't have your own privacy to be able to talk. Did that aggravate things as well?
Absolutely. I mean, it did aggravate. I mean, it aggravated it for everyone. I mean, not just youngsters. It aggravated for the wife, for the husband, for the children, for the maidservant, whoever was there in the house locked up together. I mean, it's not easy to live with someone 24/7 all the time. I mean, it's nice to have someone go out and come back. It gives you it de-stresses you. It gives you some leeway and freedom to do what you want to do. You're not 24/7 under someone's watchful eye. So that's a big kind of challenge for most of us who had to stay at home within small spaces, caught up doing our own thing, plus wanting others to do things for us. I mean, especially for the woman of the house, it must have been doubly demanding because she not only had to take care of her own official work, but she also had to take care of the house, the children, and all the pressure was on her. So domestic violence increased considerably during this time, and it was scary. I mean, it was a really scary situation. I don't know. I mean, it wasn't something anyone could do anything about because that it just happened, and we were all caught up in the same situation. A lot of people lost their loved ones. A lot of people lost jobs, lost money. There's lots more scams were happening online because people were trying to make money because they were not getting any money coming in. So they were trying to make money by any means, and they were betting and gambling and playing games to earn money. And lots of scams happened, and lots of people lost huge sums of money, and they didn't know what to do. They couldn't do anything about it. There was no one to reach out to. There was no system which actually took care of those scams, which would help you get back your money or to even find those people who scammed you. So it was a terrible situation, and it was tough for the helplines also because we were dealing with this on a large scale. I mean, earlier it used to be just a few cases coming in of these special types, and now it was almost every case had multiple reasons for calling up, multiple reasons for attempting suicide.
Yeah. Well,
So
I have
was
one more aspect to touch upon, and then we'll actually move to the second part of this conversation, which is more to do with what steps need to be taken, and if there are, policy interventions to create better infrastructures for more accessibility and affordability of help which is required. But before that, one other aspect, Dr. Kumkum, is, and this query often pops up when we have these conversations, is people saying, oh, you know what, I tried to reach out, and I was told that you should distract yourself, you should keep yourself busy, find something to do that makes you happy, and I've tried that and it doesn't work. Where does this advice of distract yourself, keep yourself busy and keep yourself happy really work, and where should that not be the advice and the advice be reach out for some professional help?
Yes, like you rightly said, when you have suicidal ideations, it usually is because of a lot of negative thoughts. There is, thoughts of hopelessness, helplessness. I'm not worthy of it, or it is a trigger. It's triggered by some sort of a stress, anxiety. So what is important is for us to have a good, effective coping mechanisms, for which therapy and reaching out to a counselor is very, very important. There is no harm in talking to your counselor. There is a lot of stigma which is right now attached to talking to a counselor, seeking therapy, which is something that has to be broken. And this, we as a society, as a community, should do this and encourage people to talk to a therapist, to get to sort of understand what are better coping strategies. Are you using some coping strategies which are not very efficient? How can you change your coping strategies? How can you change your thinking, your perception? So counseling is and talk therapy is very, very important. Also, this is a space where you can talk very confidentially. It is a safe space. So I would definitely say that, you need to bring whatever is inside. You need to discover yourself, become more self-aware of yourself, your thoughts, your emotions. And this is something that only therapy and counseling can do.
Okay, so let's then talk a little bit more about the larger changes that perhaps we can bring in, especially in a country, Dr. Mehta, Tara Mehta, where we don't even recognize this as a important issue, as important as physical conditions need to be. We don't even do that. We are far away from actually putting it on the same platform. If we look at the kind of doctors versus patient ratio is concerned, that's so skewed that it's scary. Now, so where do we begin to fix this problem?
I think it's really a multifold solution that has to be applied. I don't think there's just one step at a time. I think it has to start from awareness, literally at the school level. It has to, we need to get children aware of it. And having said that, even though it's almost mandatory to have counselors in schools, most schools still don't have counselors. So one, it has to start from literally the school level, where we help children, like she said, develop better coping skills right from a young age, so they know what to do. They are able to reach out for help, because it is somebody that they know they can reach out to directly for help in their school. So one is that we start literally from the baseline level. Secondly, at some stage, awareness just is something that has to be done multifold across all domains, across all professions, because it's not as if some professions have more, cases of stress and some have less. It's just prevalent everywhere. So I think that just basic awareness done on all platforms is essential. I think when we come to the disparity between the number of clinicians available versus the patients, there are literally less than 200 clinical psychologists who graduate every year. There aren't enough colleges which offer the course. And those which do offer the course, there aren't more than 14 to 18 seats available at any course. So somewhere, some stage, this has to be scaled. It's a dichotomy, because there is such a great need for clinicians, but there aren't enough clinicians which are being produced, especially mental health definitions. So I think that somewhere there has to be, like I said, a multifold change right from the ground level with students, awareness on a large scale basis. There has to be more courses and available to people to take up the profession. There has to be the subjects of psychology offered not just in girls colleges but also in all colleges, because a majority of clinical psychologists are women. It's a course that's largely available, in colleges just for women. So I think that this just has to be looked at as a problem from a bird's eye view, and it has to just be addressed across all domains.
Oh, yes, absolutely. You know, across the board, there will be so many steps that have to be taken to actually start addressing how to make this easier for everybody and make it more accessible as well for everyone. Dr. Maithili, would you like to weigh in on this as well? For example, what is being said about not enough professionals graduating every year because we don't have enough colleges. Why is that something that individually even states don't look at?
Yeah, this is one of the primary, reason for which mental health issues are dormant, and people are not aware whom to go, how to treat, because there are certain protocol and standard operating procedures of, treatment also. Without an MPhil degree, you cannot do psychotherapy. And there are certain other guidelines which has come out for the telecounseling and telepsychotherapy also. So, MPhil graduates are very less because the institutes are less and people are not thinking about, increasing the courses in each state. So I think this is a policy level change that people need to, make. And also about the lay counselors, how everyone is saying about community participation, teachers as well as other community leaders need to identify that this is a issue which needs to be taken, given significance like any other physical illness. So people are not aware. I mean to say, people are not aware about the signs and symptoms of mental illness because the psychological first aid is not given importance like the physical first aid. If we go somewhere, we always carry bandages, we carry antibiotics and stuff like that, because for fever we take, for cough we take, but we do not think about our mental hygiene, how to take care of. We only take care of mental issues when we have a problem. But without even having an illness, we need to take care of maintaining our mental well-being and mental hygiene. That is important, because not having a mental illness doesn't mean that you are completely okay and completely stable. So that is where we need to give importance, and maybe, the way mental illness and mental health is addressed needs to change. Because everyone is saying people do not come to us because of the stigma, because of discrimination. Yes, but I have seen a change nowadays. Young population, they tell their parents that I want to meet a psychologist, a clinical psychologist, and the parents, they bring the students to us and they sit in the other room because the parents are not aware, and they would not like to know also. That is a boundary they keep between the children and them. Nowadays I see this trend, which is very Western, which was never there before. So this is something which is changing. Children are becoming aware, it's no doubt, but not everywhere. Maybe in the urban areas, not in the rural setting. But again, the LGBT population, which he had come up with, I have an LGBT support group in Assam. So we have seen people from the rural areas also coming, transgenders, coming for sex reassignment surgeries, having mental issues. So it is like everywhere there are issues, but people need to identify that this is what it is. This is definitely needs to be treated in a holistic manner. So which I think the comprehensive treatment is lacking, which we need to emphasize in the domain of mental illness and mental health and well-being. And yes, and any other policy level changes, I think if these kind of platforms are there, then the government also will maybe hear and may do something about,
Right.
how to increase. Yes.
Right. So, the word that keeps coming up again and again is stigma. And I think, it's also because there is so much of it. And no matter how much we say that, okay, a lot more people are talking about it or campaigns are being held, people are just scared to even acknowledge it, admit it, for fear of what may happen. So, Onala, I wanted to ask you that question, even for the queer community, where already there is so much of stigma that you have to tackle.
Right.
How big is mental health as a stigma as well?
No, definitely. I think that what is the problem in society at large is something that we experience in the communities as well. There is a huge taboo around, discussing mental health, and definitely suicidal ideation still seems to be an area that not many are aware about. So, I mean, one caution here is not to think of the LGBT community as a homogeneous community. There are different kinds of people within the community. Some are new, some are activists, So what we do find is that when there have been instances where, somebody may be on the verge of attempting self-harm, they have posted a Facebook post where they are saying that I'm going to attempt self-harm. It's met with a lot of bashing actually, in fact, of the person. And when people do reach out, they expect the person to sort of apologize after posting something like that for having put other people into the trouble of, supporting this person. And I think that kind of narrative is very sort of problematic. So what we try to do is that we, in fact, in the community, we encourage like a lot of panel discussions around mental health, and to get the community familiarized with the fact that there are mental health experts who can support you. If you are sort of going through any kind of mental health challenge. The other bit is that when we do diversity and inclusion work, we try to also work alongside people who are working on a disability, and that includes mental disabilities as well, where I find this intersection between the two and talk to the communities about it. But we are a very long way away from being able to say that no, the communities are supportive if somebody is of having mental health concerns. This is largely restricted to people who may be experts in the field or do have some training around peer counseling, or have some background in therapy. Beyond this, I will say, however, that there is the community care model outside of the mental health model, which basically means that we as a community are there to support you. So what we do try to do is try to reduce the other feelings that you may have, like the loneliness that you sort of feel, the self-esteem issues that you may have. So what we try to do is we build events around things that could be causing you mental health concerns. We connect you with peers who, so there is a peer support model that is available if you are going through a mental illness. And we encourage, especially in these communities, confidentiality and to openly speak about whatever you may be facing. And this kind of community support networks have really helped. And I think it's important to remember, before the counseling model came in, we had models of family and support systems in community which worked, and we continue to use them alongside psychotherapy within community spaces.
Okay, while there are a lot of course, mental health challenges, and for good mental health, there where the community support system and a group support system may work. Dr. Kumkum, what about suicide prevention? Specifically, when we talk about suicide prevention, does that need a different approach, or can this work as well?
Yes, so for suicide prevention also, a lot of the onus now is coming on mental health on mental health organizations. However, it will be really nice if the community at large takes up this as as a challenge, to say that I don't need to be a psychologist or a counselor in order to prevent suicide. Everybody, you and I, anybody can sort of be compassionate, be empathetic towards the other person, listen to the people around you. And any teachers, be it a mother, be it anybody, can spread the awareness of suicide, and also spread the awareness of the importance of mental health. This is something that we can all do as a community, as a society, where we can help each other out, where we can look out for each other, we can support each other. What is very important is for us to remove the stigma, to remove the judgment, to remove the criticism. That is what scares people from talking or communicating about what is happening to them, or even their inner thoughts and inner feeling. So as a community, if we can do this together, and stop judging each other, and instead just listen and empathize with each other, I think, we will go a long way.
You're absolutely right. And firstly, the biggest challenge, of course, is for us individually to keep our judgments aside, to keep our own prejudices aside, and to be able to have the empathy to connect or to listen, just listen. But there's the other aspect of it also, and the other aspect of it is people not knowing what to do or what to say in such a scenario. And I come back to that point, Mr. Johnson Thomas, again and again, because people often try to get out of such situations or avoid people who may be in a tough spot simply because they don't know what to say, and what if I say something wrong?
Well, I don't blame them for running away from that because it is scary. It is a scary proposition for a normal person. I mean, to hear a loved one express suicidal ideation, it's not something that anyone can take with any. Usually, what the first defense mechanism would be to ignore it or to chide them for saying such a thing or to criticize them for saying such a thing. Or to tell them that you're just trying to play with my emotions, or using emotional blackmail to. But that's not the case. That's not the truth. The truth is that that person is actually telling you that he or she is thinking of suicide because he or she has come to a point where there is no one who really understands or cares or is willing to offer him or her the emotional support that he or she needs. And that's very crucial for anyone who's suicidal, someone to care for them, someone to show them the love, someone to tell them that they matter to them, someone to tell them that their life matters to them. And even if the loved one, even if they are angry, even if they are frustrated, even if they are disgusted or whatever with the person, if they just tell them that, okay, I am angry, I am frustrated, I am not able to deal with this situation, but I do love you. Even if that's said at that point of time, you can support that person in that form. So that's important, that you need to tell that person that you love them, that you care about them, that you are there for them, whatever happens. And it may be difficult for you, but you still will be there for them. That's something you need to be honest about and tell them that.
Mm-hmm. Okay, then there is another aspect, and again, I think increasingly there is more awareness, at least in the big cities, about the basics of it. But beyond the big cities, it's very different. The scenario on ground is still very different. So, for example, Ajay Malhotra, if somebody has reached out to a friend or a family member and is opening up, how do you tackle the situation where you have to tell them that maybe you need to reach out for professional help without it becoming a uncomfortable or an ugly situation, because not too many may take it very well?
In this discussion, we had came across that the first and foremost support group is your own family. Then it further extend to your maybe good friends, maybe to your colleagues. If they are not available, then Symmetry is there, and NGO like us are there to help them out. We assure them a confidentiality that whatever they are not able to share with anyone else, they can share the same with us also. But when we talk to the people, when we share their feelings with us, in case we feel that there is a need for medical intervention also, so we support them to avail the facility of the medical intervention. By and large, we do we give our help as a support group. We talk to the people, and as a support which they are not able to take from their family or friends, they take from us.
Okay, Dr. Kumkum, would you also like to come in here? Because often when we a lot of times open up our call lines for people to call and ask questions, and we get this query that how do you politely put it across to somebody, and at what point do you say that, look, I am here to listen to you, but maybe you need some professional help as well?
So, the thing is, it is important for us to tell them that, you need professional help. A lot of times we are shy. We feel, because of the stigma that is there, we feel shy to tell others that, hey, you need professional help. We feel that the other person may take it in a bad manner or may not take it in a positive manner.
Correct.
But if you really, care for that person, there is no harm in telling them directly, like, I can't help you. You need a professional help. Supposing the person you're talking to has a fracture, won't you recommend a professional help? Won't you recommend an orthopedic? Then why not for this? Why do we need to tell them in a polite manner when you can tell them directly the truth that, hey, maybe, when, like you say, your bone is broken, let's go to the orthopedic. Hey, I think you need a psychologist. Why can't we make that happen in the society? Why can't we say that mental health is as important as physical health?
Oh yes, absolutely. The thing that I repeatedly say is that the mindset has to change for us to accept that mental health is as important as physical health, and in fact, your mental health will impact your physical health as well if it's not in a good condition. And that's something most people don't understand, Dr. Tara Mehta. Sometimes even your body physically is giving you the symptoms that mentally you're not at peace, and that needs attention.
I think it's important to help realize that your mind is, or your brain or your mind is it's a part of your body. It's a different organ. So if you're looking at your lung, your liver, your kidneys, your mind or your brain is just another organ of your body, which has to be treated as another organ which requires help when needed. If you look at it from that perspective, then there's no reason why you should, not be able to suggest a professional and an expert in that area to help you with it. But when we're talking about creating awareness and how your original question was, if we can help, on a larger scale, I think that changes have to come almost at a government level where, as Kumkum said, that's, it'll be nice if communities came and helped out. But honestly, if we really want to make a change where suicide is concerned, it's not a question of if. Communities have to come and help us. There aren't enough of us experts out there to help everybody. So whether it is, RWS getting trained, the municipality getting trained, just dealing with, of course, not the more serious issues, but just to be able to step in at the initial issues for intervention. I think that even if you start off in those smaller scales, whether it's your, GPs who are trained or family doctors, who are the first point in contact, I think that if we need to literally start at that level to be able to provide some sort of help to everybody who needs it, because there just aren't enough experts available, trained experts available to deal with the cases at the numbers that they are.
So who does that? Who do we look towards to say, okay, let's ensure that in societies, in schools, in colleges, in corporate offices, even within the medical community, people are being trained, people are being sensitized, because at this, whose responsibility is that? Dr. Tara, to you, yes.
Yeah, I think that the responsibility, honestly, somewhere, I think just as basic human values, one has to sort of say that, each one of us, as busy as our lives are, need to take that initiative to realize that everybody around us may benefit if we are willing to put ourselves out there and help, even if it's just people in our building. I think that the small initiative has to come from an individual level. Honestly, no one's going to otherwise, sort of look, if you're not looking inwards, you're not going to be able to mobilize forces. So at some stage, you've got to just say that, what, I have to do my part, because if I'm not there to be able to do and listen to somebody for 5-10 minutes or 10 minutes just in my building, if just that intervention starts off, I think it'll have almost like a rebound effect where more people will be mobilized and will be able to see the change that is being created. But it has to honestly start with an inward sort of motivation to change things.
Okay, on that note, I'm going to thank all of the panelists for joining me on this conversation. Thank you for taking the time out. The fact that today was World Suicide Prevention Day was just another excuse for us to take up this topic and to have this conversation, which we usually do, and we try to have these conversations more frequently, at least once or twice a month, because it's that important. If there are specific aspects that you would want us to raise, to ask our experts to address, specific issues that you would want us to talk about when we have our mental health conversations, please do write to us. You can tweet to us. Usually we open up our call lines as well, or you can call us as well. This is a conversation. Let's Talk Mental Health as a series is a conversation that I am having not just with the experts, but also with you, the viewers. So do join in. Thank you so much for tonight and being a part of it.